1st of July, but it will all depend on the state's COVID-19 metrics.
Now, with all the challenges we face opening schools, boosting our economy, and tackling racism head-on, we must remember that this virus is still out there and can be deadly.
And to that end, today the governor and health officials urged anyone who's been at a protest or mass gathering recently to get tested for COVID-19.
The U.S. is running out of the only drug known to help with COVID-19. We're hearing this from doctors with the U.S. Department of Health and Human Services. One doctor says that the last shipment of remdesivir goes out June 29th. The company that makes it is ramping up production and hopes to have more this summer. A study shows remdesivir reduces the number of days coronavirus patients spend in the hospital.
We want to break down the latest numbers for you, and 7 News anchor Gordon Dill is going to walk us through today's totals as well as take a look at what kind of trend we are seeing. So Gordon, fill us in.
Thank you, Diane. And while we've been doing this for the past few weeks, we've tried to show you day by day over a 21-day period how many positive tests the state is seeing for COVID-19. But today, because the numbers have been so striking the last week or 10 days, we're going to go a bigger view. You will not need a degree in statistics to see the trend here. Let's show you South Carolina. This is 54 days worth of data all the way over here. We're starting at April 14th all the way up until today's numbers. Today, the state giving us the highest number of confirmed COVID-19 cases yet, more than 540. That's something I've said a lot lately because all of the highest numbers, the top 9, have all come in the last 10 days. In fact, take a look at this. You can see the trend relatively flat for the first 2 months of this disease. But about the time we got to Memorial Day, we've seen an explosion in that trend. This is it, the last 10 days here, where the average rolling 7-day number of confirmed cases in the state is about 340 or so, substantially higher than we'd seen in previous months. And while, yes, from April 14th to today, we are seeing much more widespread testing. The percentage of those tests that come back positive is up substantially as well over the last 2 weeks and even over the last 4 weeks. We can show you the same thing in North Carolina here, the same thing, 54 days worth of data here. And you can see North Carolina, while more steady in its increase, is also trending up sharply. Look at this. These are the most recent numbers. Compare that to segments of time over the last 2 months. North Carolina today announcing 938 new cases, 10 more people in that state have passed away. In fact, the state secretary of the Department of Health and Human Services said this about positive tests.
And our percent of positive tests that are, the percent of tests that are positive is now among the highest in the nation. I am concerned. These trends moving in the wrong direction is a signal we need to take very seriously.
It is serious in both Carolinas, folks. In fact, on a national scale, the Carolinas, that increase in positive tests in the Carolinas ranks at the very top in the country. It is the one to pay attention to. The Carolinas are seeing a very rapid increase in the number of people being diagnosed with that disease. In fact, to that point, let's show you Georgia here. Here's 54 days worth of Georgia, and what you don't see over the last few weeks in Georgia is that big spike at the end. Now, these numbers, generally speaking, are a little higher than the Carolinas most days. That is no longer true. The Carolinas are catching up to Georgia, and the trend is the thing to keep an eye on. Today, the Georgia Health Department announcing 599 new cases, and in that state, another 28 people have passed away.